Hello, and welcome to our next episode of Coffee with Kelsey. I'm happy to invite you here today to learn more about Adoray Home Health and Hospice and introduce you to another team member of ours here at Adoray. So today I have with me our Hospice Medical Director, Dr. Simon Mittal. Welcome. And so November is National Hospice and Palliative Care Month. So today we're going to discuss a little bit more about what Dr. Mittal's role is here at Adoray and learn more about our hospice services. So to begin with, Dr. Mittal, could you tell us a little bit about your background and what drew you to Adoray?
Yeah, thank you. Well, thank you for welcoming me here. I appreciate that. I've been a physician for the last 26 years, and I've done a lot of work in a lot of different arenas. Over that time, I've been a Hospice Medical Director in lots of different ways. I've been, for the last 8 years, a medical director for a larger organization. And I was really looking for an organization that was wanting to sort of move forward. And how do they want to innovate? How do they want to improve their quality, their services? And Adoray really wants to do that. And one of the things I'm very excited about is I've gotten to meet all of the team members is their passion for hospice and how that's going to play a role in how we service the communities we serve. I'm very excited about that.
Wonderful. Well, would you be willing to also share with us what your role is with the hospice team? How do you support the hospice program?
Yeah, there's a great team, right? We've got a great team of team members who just really put their passion out there. My role as medical director is really to support them from a clinical standpoint when there are concerns about how to manage symptoms or whether somebody qualifies. Those are some of the things that I think are really important. One of the things that I'd really like to see is that we can service more people in a way that really supports the family needs as well as the individual's needs in terms of symptoms or pain or whatever it might be, so that they can really enjoy what the time they have with their loved ones. I think that's super important. I also want to oversee quality, and quality is a big issue for healthcare in general, and specifically in hospice. How do we define quality? How do we improve quality? What are the processes involved? And those kinds of things I think are really important in highlighting what we do at Adoray, knowing how we have already pushed ourselves to improve quality and knowing that we've got more that we can do. And I think the last part is really innovating. How do we innovate so that we can not only provide kind of what we would consider standard services, but how do we expand that? And how do we provide those kinds of things that really have an impact in communities, with individuals, and with their families, so that they can really enjoy those time frames with their loved ones.
Mm-hmm. So you touched on a really great point, and when you joined our team, you mentioned in our service area we have really low hospice utilization rate. And so what are your thoughts around hospice utilization, and what does that mean for quality of patient care and quality of life?
Yeah, it's a great question, because I think one of the things we often see is we've got a great community of providers, right, who are trying to do the best they can with all of the care that is needed for these communities. I really believe that hospice care is an essential part of how we improve quality. And I think the sooner we can get people on hospice, the more support we can give families, the more support we can give individuals, and the more that they're likely to enjoy that time period. I think there's a lot of fear around end of life, which is normal and natural. And it's really about how do I enjoy that time. And I'll give you a quick story. My father had both Parkinson's and dementia. And toward the end, it was really difficult. And so I really wanted to make sure that the time I spent with him, my siblings spent with him, was not about his care. It was really about how can I enjoy those last times with him. And it was amazing having hospice in that role, to be able to really sit as a son and not as a caregiver, and to be able to really enjoy that time with him. It was amazing. And I think those kinds of experiences for me, my mother did not have hospice, and she died young with breast cancer, and I really wish we had had that. And so now, having seen both of those experiences, to be able to say that I know that hospice can really have an impact in how communities really look at end of life. We want our providers in our communities to really know that Adoray is here to serve. We're here to support, we're here to encourage, and we're here to really provide what we see as high quality care as it pertains to those end of life concerns.
Wonderful. Well, we've talked a lot about hospice. What's the number one thing that you would like people to know about hospice care?
I think that oftentimes people get concerned when we talk about hospice, and we will really want to change the perception that it's not about somebody dying. It's actually about somebody living the best life they can for as long as possible. And what does that look like? And how do we do that? So that we're managing these symptoms in such a way that families, communities can enjoy that time. And so I think the earlier that we can get people on hospice and have that support in place can really make an impact. And it does improve quality of care. And there's actually a number of studies that really talk about that in terms of how quality of care improves as we have people on hospice for longer periods of time. I think it's important to realize that hospice is available for 6 months. So if you've got a prognosis of 6 months or less, you do have the ability to use hospice. But it also doesn't mean that you have to stay on hospice. And if you get better, that's awesome. And we want that. And if that's possible, that's great. That's what we want to try and achieve as well. And so hospice isn't a forever thing. It's a support system that really can help provide amazing care with an amazing team. And we want to be able to provide that.
Wonderful. Thank you so much for joining us today and sharing all of your insights and information on hospice. And thank you all for tuning in for this episode of Coffee with Kelsey. Happy National Hospice and Palliative Care Month to all of our hospice and palliative care providers out there, and tune in next month for our next episode.